Hello everyone. In this class, we'll learn about adrenal cortex. Adrenal cortex has three important layers which are called as zona glomerulosa, zona fasciculata and zona reticularis. Zona glomerulosa produces mineralocorticoids, zona fasciculata produces glucocorticoids and zona reticularis it produces sex steroids, that is androgens. Coming to mineralocorticoids, aldosterone, the chief mineralocorticoid secreted from the adrenal gland is uh, aldosterone. The other mineralocorticoids are deoxycorticosterone, 9-alpha fluorocortisol, which is synthetic, and mineralocorticoids, they are called as life-saving hormones. If you see their effect on the renal tubules, they increases reabsorption from the tubular fluid into the tubular epithelial cells. They also helps in potassium excretion, that is active reabsorption of sodium occurs in exchange of uh, potassium and hydrogen. So thus they also helps in excretion of H plus ions. Their effect on the extracellular fluid volume. When sodium is reabsorbed from the renal tubules, simultaneously water is also reabsorbed, which causes increase in the volume of extracellular fluid. If you see its effect on blood pressure is increased due to the increase in extracellular fluid volume and blood volume. Aldosterone escape. When aldosterone secretion increases, extracellular fluid volume and blood volume is increased, leading to rise in the blood pressure. Elevated blood pressure stimulates secretion of atrial natriuretic peptide from atrial muscles, and it causes excretion of excess salt and water through the urine, which is called as pressure natriuresis and pressure diuresis. So thus the content of salt and water in ECF becomes normal in spite of increase in the secretion of aldosterone, which leads to uh, prevention of the edema is called as aldosterone escape. If you see its effect on the salivary and sweat glands, sodium reabsorption from sweat gland and loss of sodium is prevented. And if you see the effect on the intestine, it enhances the sodium reabsorption from the intestine, especially in the colon, and prevents the loss of sodium through the feces. Mechanism of action of aldosterone. Aldosterone binds to a cytoplasm receptors, and this receptor hormone complex moves to the nucleus where it alters the transcription of mRNAs. This in turn increases the production of proteins that alter cell function. The aldosterone stimulated proteins have two effects. Initial rapid effect to increase the activity of epithelial sodium channels, and a slower effect to increase the synthesis of epithelial sodium channels themselves. Aldosterone activates the gene for serum and glucocorticoid regulated kinase, and this SGK increases the epithelial sodium channel activity. Aldosterone also increases mRNA for three subunits that make up epithelial sodium channels. And aldosterone also increases the activity of membrane sodium potassium exchanges, and this produces an increase in the intracellular sodium. Regulation of aldosterone secretion. Four factors are involved in the regulation. The stimulatory agents for aldosterone secretion are given below in the order of importance. The first thing is increasing the potassium concentration ions in the extracellular fluid volume, then increased activity of renin-angiotensin system, then decrease in sodium ion concentration, and ACTH are the regulatory factors for aldosterone secretion. So whenever there is increase in potassium concentration, decrease in sodium concentration, decrease in extracellular fluid volume, it stimulates the extraglomerular apparatus to produce angiotensin. Angiotensin gets converted into angiotensin 1, then 2. Then it is going to stimulate adrenal cortex to produce aldosterone. Aldosterone acts on the kidney, and it helps in the excretion of the potassium, retention of the sodium, and retention of the water. Thus it decreases potassium concentration, increasing the sodium levels, and increasing ECF, which by feedback controls the juxtaglomerular apparatus. Coming to glucocorticoids, cortisol is the chief glucocorticoid. The other glucocorticoids are corticosterone, cortisone, and these glucocorticoids, they are called as life protecting hormone. Say their action, their metabolic effects, first on the carbohydrate metabolism, it exerts anti-insulin effect by increasing gluconeogenesis, by enhancing the breakdown of proteins in the extrahepatic cells. They also increases the synthesis of enzymes required for gluconeogenesis, and they exert an anti-insulin effect by inhibiting glucose uptake and utilization by peripheral cells. If you see its effect on protein metabolism, decrease cellular protein and increase liver plasma protein occurs by decreasing the protein synthesis by inhibiting amino acid transport into extrahepatic cells and inhibiting the formation of RNA. It also stimulates catabolism of proteins in all body parts except in the liver. It also enhances amino acid transport into the liver cells and also enhances liver enzymes required for protein synthesis. And its effect on fat metabolism, it mobilizes fat from adipose tissue and enhances the oxidation of free fatty acids in the cells. It also increases the utilization of fat for energy. Effects on electrolyte and water metabolism, increase in the retention of water and excretion of potassium by the kidney is important effect, and it also accelerates the excretion of water. Adrenal insufficiency causes water retention. Physiological actions on various organs and system effect on the muscle. There will be hypersecretion causes muscular weakness, which occurs due to the excess protein catabolism. And the effect on the bone, it increases the bone resorption and it inhibits the bone formation. Its effect on vascular system, it is essential for constrictor action of adrenaline and noradrenaline. In adrenal insufficiency, blood vessels fail to respond to adrenaline and noradrenaline leading to vascular collapse. Effects on central nervous system, insufficiency causes personality changes like irritability and lack of concentration. And effects of blood and cells and lymphatic organ, it decreases circulating eosinophils and basophils. It increases the number of neutrophils, platelets and RBCs. It decreases the circulating lymphocyte count and size of lymph nodes and thymus. Its permissive action on some of the hormones, like some of the actions of other hormones, they are executed only in the presence of glucocorticoids. For example, the calorogenic action of glucagon, pressure activity of catecholamines, bronchodilation of catecholamines, and lipolytic effect of catecholamine occurs only in the presence of glucocorticoids. Effects in resistance to stress. Exposure to any type of stress increases secretion of ACTH, which in turn increases the secretion of glucocorticoids. And it enhances resistance by immediate release of amino acids, that is synthesis of new proteins, and fatty acids are released from the cell, which is required for energy supply, enhances the vascular reactivity to catecholamines and prevent the severity of other changes in body caused by the stress. Its anti-inflammatory effects. It blocks the early stages of inflammation process before inflammation begins. If the inflammation has already begun, it causes rapid resolution of inflammation and increased rapidity of healing. These are the some effects. It is going to stabilize the lysosomal membranes so that proteolytic enzymes are not released. It decreases the permeability of capillaries so that loss of plasma is prevented. It decreases both migration of WBC to the inflamed area and phagocytosis of the damaged cells, and thus it decreases the release of prostaglandins and leukotrienes. They suppress the activity of T cells and other leukocytes so that there is a decrease in the reaction of the tissue. They also reduces the release of interleukin-1, so the temperature is reduced, which in turn reduces the vasodilatation. They also inhibits the phospholipase A2, because of which less arachidonic acid is formed, and they're also anti-allergic, which prevents various reactions in allergic conditions. And this is how cortisol production is regulated. It is mainly by the negative feedback mechanism. When hypothalamus produces releasing factors, it acts on anti-repituitary to produce ACTH, and ACTH acts on adrenal cortex to produce cortisol. And this cortisol, by negative feedback mechanism, uh, inhibits anti-repituitary and hypothalamus to produce less amount of cortisol. Circadian rhythm of glucocorticoid action. The secretory rates of CRF, ACTH, and cortisol are high in early morning but low in late evening. This effect results from 24-hour cyclical alteration in the signals from hypothalamus that cause cortisol secretion. Stages of inflammation. Substances that activate inflammation process such as histamine, bradykinin, proteolytic enzymes, prostaglandins, and leukotrienes are released from the damaged cells, and there will be increase in the blood flow in the inflamed area. There will be leakage of plasma out of the capillaries into the damaged areas due to the increased capillary permeability, followed by clotting of tissue and fluid causing non-pitting type of edema, and infiltration of these area by leukocytes, and lately after days or weeks the ingrowth of the fibrous tissue that helps in the healing process. And most of these stages of inflammation, they are inhibited by glucocorticoids. Applied aspects. Whenever there is a hyperactivity of adrenal cortex, it is going to lead a group of symptoms which is called as Cushing syndrome. Obviously, it occurs because of the hypersecretion of glucocorticoids, and there will be increased in the glucocorticoids secretion accompanied by increase in the secretion of adrenal androgens. Some of the causes for Cushing syndrome are adenomas of the anteripituitary that secretes excess ACTH, and abnormal functions of hypothalamus that causes high levels of corticotropin releasing hormones, and ectopic secretion of ACTH by tumor elsewhere in the body. They are also caused by adenomas of the adrenal cortex. Cushing syndrome due to the anterior pituitary is called as Cushing's disease. That is Cushing's disease. The etiology is here. There is a tumor in the anterior pituitary. Signs and symptoms of Cushing's syndrome. There will be disproportionate distribution of the body fat producing following features. There will be moon face due to the accumulation of the fat in the face. There will be buffalo hump due to the fat accumulation in the upper back. There is a pot belly due to the fat accumulation in the upper abdomen. Purple striae are seen, which are reddish purple stripes on abdomen due to the stretching of the abdominal wall by increased subcutaneous fat, and it also due to the deficiency of collagen fibers due to the protein depletion, which causes thinning of the skin, and this also occurs because of the rupture of subdermal tissues due to the stretching. Other features are there will be thinning of extremities. The muscle are poorly developed due to the protein catabolism, facial hair growth, and there can be presence of acne because of the effect of androgens. The wound heal poorly, and minor injuries causes bruises and ecchymosis. There will be hyperglycemia due to the gluconeogenesis. There will be increased bone resorption, which causes osteoporosis. There can be mental abnormalities, and there can be blackening of the skin due to the pigmentation of the skin by melanin stimulating hormone like activity of the ACTH. And it is associated with hypertension due to the increase in the retention of sodium and water. So this is the typical clinical feature of Cushing syndrome. You can see the red cheeks, moon face, bruisability and ecchymosis, thin skin, poor muscle development, and there can be poor wound healing, pendulous abdomen and purple striae and fat packs over the neck. The treatment of Cushing syndrome is the removal of the adrenal tumor and tumors in the pituitary gland that oversecrete ACTH can be surgically removed or destroyed by radiation. Then there can be serotonin agonist and GABA transaminase inhibitors which can inhibit ACTH secretion can also be utilized. And ultimately the bilateral adrenalectomy if ACTH secretion cannot be decreased. Hyperaldosteronism, depending on the cause, it can be classified as a primary hyperaldosteronism and secondary hyperaldosteronism. Primary hyperaldosteronism is called as Conn's syndrome, where the renin secretion is depressed due to the feedback suppression. The most important effects are hypokalemia, slight increase in the extracellular fluid and blood volume, and hypertension. Due to the hypokalemia, muscles are paralyzed. Some of the causes for hyperaldosteronism are adenoma of the zona glomerulosa, adrenal hyperplasia, and adrenal carcinomas. Treatment is mainly the surgical removal of the tumor or adrenal tissue when hyperplasia is the cause. Secondary hyperaldosteronism occurs due to the extra-adrenal causes like cirrhosis of the liver, heart failure, and nephrosis, where the decreased level of the potassium and reduced levels of sodium, they causes the secondary increase in the levels of sodium and decrease in the potassium levels. Adrenogenital syndrome, which is also called as virilism, it occurs because of the tumor in the zona reticularis of the adrenal cortex, which causes intense muscularizing effect throughout the body. In the females, they cause development of the male secondary sexual characters such as beard, deeper voice, muscular body, and enlargement of the clitoris and baldness. In prepubertal males, it produces same characteristics as in females, along with rapid development of male sex organs. In males, the effects are usually masked due to the effect produced by the testosterone. Hypoactivity of the adrenal cortex, Addison's disease. Addison's disease is due to the insufficiency of mineralocorticoids as well as glucocorticoids. Some of the causes of the Addison's disease are complication of the tuberculosis, some autoimmune inflammation of the adrenal glands. Sign and symptoms during glucocorticoid deficiency. They are going to produce weight loss, nausea, vomiting, weakness, tiredness. Since glucocorticoids are essential for adaptation to stress, therefore in Addison's disease, exposure to any type of stress can be fatal. Mineralocorticoid deficiency produces hyponatremia, hyperkalemia, acidosis, decreased extracellular fluid volume with hypotension, and they have a small heart, and the hypotension is going to decrease the work done by the heart. And increased ACTH secretion occurs due to the feedback mechanism and produces pigmentation of the skin and mucous membrane because its activity is very similar to melanin stimulating hormone. And treatment of Addison's disease is administration of mineralocorticoids and glucocorticoids daily. Addisonian crisis. Great quantities of glucocorticoids are occasionally secreted in response to different types of physical and mental stress. In person with Addison's disease, the output of glucocorticoids does not increase during stress. Yet, whenever different types of trauma, disease, or other stress, a person is likely to have an acute need of excessive amounts of glucocorticoids, often must be given 10 or more times the normal quantities of glucocorticoids to prevent death. This critical need for the extra glucocorticoids and associated severe debility in times of stress is called as Addisonian crisis. So this is in brief about adrenal cortex. Thank you.